to Body Beautiful. Right now we're talking with Dr. Elizabeth Lee about ways to prepare our body for the summer. First, let me remind you that we will be taking your calls with any questions you might have for the doctor. Here's the phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And our caveat, any advice we give you today, you'll also want to consult your own physician as well. Last segment, we were talking about different options that people have for improving their body shape, kind of fine-tuning instruments.
Right.
How about breast augmentation?
Well, you know, breasts are more visible when we're wearing bathing suits, and you know, you can do lifts or augmentations. I think I brought a picture today of just an augmentation so that people can see that things can be done very subtly and really.
Yeah, there you go. We're looking at them now.
Right, and so you know, this is a woman who basically nursed several children, and her breasts pretty much disappeared, and she's very athletic, so she did not want very large breast augmentation. She doesn't want breasts that are heavy or get in her way when she runs. But you know, this is a very subtle change, and she wears a bikini now, as you can probably tell from her suntan, and she's thrilled.
I imagine she is.
And you have time to do this and still get into a bathing suit.
And it looks like it fits her frame. So
yeah, she's very small. She's an athlete. She's very small frame.
Okay. And how long does a breast augmentation procedure take?
Well, you know, from the time you come in to see me, we can get you scheduled within a couple of weeks. It's usually about 2 hours in the operating room, and you go home that same day. And I generally tell patients to take a week off of a desk job for recovery.
Okay. You brought some other photographs with you. And let's take a look at. Is this liposuction here? Yes.
Right. So, you know, here's a patient who is kind of, you know, what we were talking about earlier. So she's a little full around her thigh. She's otherwise in great shape. She could drive herself crazy dieting and trying to get rid of that little bit of extra weight. But we've done a little bit of liposuction, and what you see is that her contour is a whole lot better. She's also really happy, and she felt comfortable. She feels comfortable now going out in a bathing suit.
So this is someone who worked out and just couldn't get that last.
So on the outside and the inside of the thighs. That last little bit.
So you just kind of enhanced nature a little bit there.
Yeah, a little bit, or de-enhanced, which all right, let's not do that.
You had your artistic touch to it.
Yeah, thanks.
You also brought some pictures with you, a photofacial procedure, and this is, you know, especially for those people who go in the sun a lot.
Right.
You get those brown spots.
Exactly. I mean, you know, one of the things I think about over the summer is that it's not really comfortable to wear a whole lot of makeup. So if you can get your skin to the point where you feel like you can go out with a naked face, that's great. So what this photofacial does is treat the pigmented and some of the red, you know, changes that you can get in skin with chronic sun exposure. And so this is an example that you see with the pre-treatment on the left, obviously, and the after on the right. And but the thing to remember is that you need to protect your skin from the sun. I hesitate in these days of, you know, kind of rampant vitamin D deficiency to tell people to stay out of the sun altogether, but facial skin ages a lot, and that's what shows. You're not going to cover it up with a turtleneck sweater. So so, you know, you just want to keep your skin on your face as protected from the sun as possible.
And I know you lecture all your patients.
Yes.
Slather up,
right? Yes.
Now that's a whole other discussion.
Right, but again, you need a
skin
sunscreen that has at least 5% zinc oxide in it. I'm not a big advocate of any of the chemicals that say they're actually UVA and UVB protectant.
Okay, let's jump into the phone lines just for a second here. I want to talk with Lynn from Castro Valley. Good morning, Lynn.
Hi.
Hi, do you have a question for Dr. Lee?
Yes, it's about the sagging skin that you develop, like going into your later 40s. Do you really need the plastic surgery? Or I have seen on another program that you could actually have a doctor take a needle, inject like 3 ounces, or not 3 ounces, 3 tablespoons of fat under your skin. Is that true?
Inject, yes, you can. I think you're talking about fat grafting to restore volume, and I assume you're talking about in the face. Fat grafting can be used to restore volume that's lost as we age in the face. It's not a technique that I do, and although I've been trained in it, and the reason I don't do it is that the persistence of that fat is very unpredictable, and in my experience, it is unpredictable in the fashion that it'll take on one side and not on the other, or it takes too much and then it grows as you gain weight. So that in these days where I think we have very, very good choices in injectable fillers that are not actually fat, we can do a lot without going to the operating room and without the risk of there being kind of inconsistent take of the fat graft.
Yeah, lumpiness
so I don't do it.
Not something that you want.
Lumpiness is not next to godliness, we know.
Thank you.
Okay.
Thank you, Lynn. Thought I'd try to get in one call there. Yeah. We have to take a quick break, but for more information about Dr. Lee, you can call her at 510-704-2170 or visit her website at artfulsurgery.com. And when we come back on Body Beautiful, we'll continue our talk with Dr. Lee about all things summer, from tip to toe. We'll also take your phone calls.